Trump's new law, health crisis in ACA holdout states. In states that oppose the Affordable Care Act, ACA, the new law signed by President Trump is set to bring significant health consequences, affecting millions of Americans. Miami, August 5, 2025, 5 a.m. EDT, KFF Health News. Despite the resistance from Republican lawmakers in 10 states that declined the ACA's Medicaid expansion for over a decade, arguing that their conservative approach would yield long-term benefits, the reality is turning out quite differently. The Republican-passed budget law, known as the One Big Beautiful Bill, is expected to impose substantial burdens on patients and hospitals, even in states that never expanded Medicaid. Hospital executives and officials warn that the impact could be just as severe in these holdout states as in the 40 states that did expand Medicaid coverage to more low-income adults. For example, Georgia, with a population of just over 11 million, is projected to lose as many people from ACA marketplace insurance as California, which has more than triple the population. This estimate comes from KFF, a health information nonprofit that includes KFF Health News. The new law introduces stricter paperwork requirements for Obamacare enrollees, shortens the annual enrollment period, and reduces funding for navigators who assist individuals in choosing health plans. These changes are likely to have a more pronounced effect in non-expansion states like Florida and Texas, where a higher proportion of residents rely on ACA plans. The budget law, which trims federal Medicaid spending by over $1 trillion over the next decade, will affect more than 71 million low-income and disabled individuals. According to the Nonpartisan Congressional Budget Office, CBO, the law will result in 10 million people losing coverage over the next decade. While many provisions target the 40 states that expanded Medicaid under the ACA, the consequences are not limited to these states. A conservative proposal to cut more generous federal payments for people added to Medicaid by the ACA expansion was not included in the final law. Politicians in non-expansion states should be furious about that, said Michael Cannon, Director of Health Policy Studies at the Cato Institute, a libertarian think tank. The situation could worsen in non-expansion states if enhanced federal subsidies for Obamacare plans expire at the end of the year, leading to premium increases as early as January and a rise in the uninsured population. KFF estimates that as many as 2.2 million people in Florida alone could become uninsured, a state where lawmakers refused Medicaid expansion and now leads the nation in ACA enrollment. For individuals like Francois Cham of Miami, who relies on Obamacare coverage, the Republican policy changes could be life-altering. Before having insurance, the 62-year-old single mother would donate blood just to check her cholesterol and could only afford an annual wellness exam at Planned Parenthood. With an annual income of about $28,000, she currently pays around $100 a month for an ACA plan to cover herself and her daughter, which already strains her budget. The prospect of unaffordable premiums at the end of the year is deeply concerning. Obamacare has been my lifesaver, Cham said, choking up as she described the safety net that health insurance has provided her. Health policy expert Cindy Mann, with Manat Health, a consulting and legal firm, and a former deputy administrator for the Centers for Medicare/Medicaid Services, warns that the expiration of enhanced ACA subsidies will hit everyone hard. But a state that hasn't expanded Medicaid will have marketplace people enrolling at lower income levels, so a greater share of residents are reliant on the marketplace, she explained. While GOP lawmakers may attempt to further cut Medicaid this year, health policy experts and hospital industry observers suggest that states that expanded Medicaid largely made a wise decision. In contrast, states that did not expand Medicaid are facing similar financial pressures without any of the benefits. KFF Health News reached out to the governors of the 10 non-expansion states to gauge their reactions to the budget legislation. Spokespeople for Republican Governor Henry McMaster of South Carolina and Republican Governor Brian Kemp of Georgia did not indicate whether their states are reconsidering Medicaid expansion. Brandon Chirachak, a spokesperson for McMaster's office, stated that South Carolina's Medicaid program focuses on low-income children, families, and disabled individuals, and does not anticipate a significant impact on the state's Medicaid population. However, enrollment in ACA marketplace plans nationwide has more than doubled since 2020 to 24.3 million. If enhanced subsidies expire, premiums for Obamacare coverage could rise by more than 75% on average, according to a KFF analysis. Some insurers are already planning to increase their charges. The CBO estimates that allowing enhanced subsidies to expire will increase the number of uninsured people by 4.2 million by 2034, compared to a permanent extension. This would compound the coverage losses caused by Mr. Trump's budget law. That is problematic and scary for us, said Eric Boley, president of the Wyoming Hospital Association, emphasizing the potential collapse of the insurance market in his state, which did not expand Medicaid. As the uninsured rate rises in non-expansion states and the budget law's Medicaid cuts loom, lawmakers acknowledge that state funds will not compensate for the loss of federal dollars. Grace Hogue, press secretary for Kansas Governor Laura Kelly, a Democrat who supports Medicaid expansion, noted that Kansans' access to affordable health care will be harmed, and the state's rural hospitals cannot make up for these cuts. For hospital leaders in other non-expansion states, the budget law poses additional challenges by limiting financing arrangements that states used to boost Medicaid payments to healthcare providers. Beginning in 2028, the law will reduce these payments by 10 percentage points annually until they align with Medicare rates. Richard Roberson, president of the Mississippi Hospital Association, highlighted how the state's use of directed payments in 2023 increased Medicaid reimbursements from $500 million to $1.5 billion, helping keep rural hospitals open. That payment program has just been a lifeline, he said. The budget law includes a $50 billion fund to protect rural hospitals and clinics from changes to Medicaid and the ACA. However, a KFF analysis found that this fund would offset only about one-third of the cuts to Medicaid in rural areas. During his first term, Mr. Trump encouraged Florida, Tennessee, and Texas to reject Medicaid expansion by offering them a 10-year extension for financing programs known as uncompensated care pools, which generate billions to pay hospitals for treating the uninsured. These funds are not affected by the new tax and spending law, but do not provide the same benefits as insurance coverage. States like Florida, Georgia, and Mississippi have not only declined the additional federal funding from Medicaid expansion, but also spend less than the national average per Medicaid enrollee, offer fewer or less generous benefits, and cover fewer categories of low-income Americans. Mary Mayhew, president of the Florida Hospital Association, criticized the state's Medicaid program for inadequately covering children, older people, and people with disabilities due to low reimbursement rates. Children don't have timely access to dentists. Expectant moms don't have access nearby to an OBGYN, and we've had labor and delivery units close in Florida, she said. She warned that the law will lead to worse health outcomes, higher costs, and increased dependence on emergency departments. KFF Health News, a national newsroom producing in-depth journalism on health issues, is part of KFF, an independent source for health policy research, polling, and journalism. Inside the Obamacare tax fight, what you need to know. The fight over the expiration of Obamacare subsidies is heating up and is about to become even more intense when Congress reconvenes in September. This looming deadline threatens to unravel the financial support that millions rely on to afford their health insurance through the Affordable Care Act, ACA. But here's where it gets controversial. Despite broad recognition of the importance of these premium tax credits, reaching an agreement to extend them feels like climbing a steep hill with very little time left to maneuver. As lawmakers head into the August recess, the prospects for a swift deal are uncertain at best. The enhanced subsidies, designed to make ACA plans more affordable, are at risk of disappearing unless Congress acts swiftly. This is the part most people miss. The complexity and political stakes involved mean that even with bipartisan support for health coverage, the path to preserving these benefits remains fraught with challenges. This glimpse offers a window into the ongoing debate that shapes the future of health insurance subsidies, a critical issue that affects millions of Americans' access to health care. Understanding the intricacies of this fight is essential to grasp what's at stake and why time is running out. If you want a deeper dive into the financial services and tax policy aspects behind this debate, you're getting a preview of our exclusive coverage in Premium Policy, The Vault. For the full detailed story, subscribing is necessary. Editorial photos in this story were provided by Getty Images, with political advertisements courtesy of Ad Impact. What do you think? Should Congress prioritize maintaining these subsidies to protect affordable coverage? Or are there better approaches to fixing the health insurance system? Your thoughts might spark an important conversation.